to do is going to be for patellofemoral pain or like a tracking disorder. You can take just a roll of pre-wrap. I like to wrap above the knee, and you're just going to go around a couple times. That applies a little bit of tension. I would say like 2 or 3. And then you'll roll down. I start here above the knee so that you're not pulling hair and all that fun stuff. You just roll it down. And you want to make sure that you place it, if this is the tibial tuberosity and this is their kneecap, right in the middle. This way, your patellar tendon runs right over that and it attaches right here. If they're having pain here because of patellofemoral or tendonitis or anything, the point of the band is to make a false second attachment place. So then the strain isn't all on the attachment here. It's now distributed here and there's less pressure on the knee, giving the patient relief from the pain. So that would be your patellofemoral strap. So this tape job can be used for kind of bracing any of the ligaments in the knee, whether you're doing the MCL, LCL, or your ACL or PCL. So you're going to start by taking your pre-wrap and wrapping their leg. I like to go from about mid-shin or right over the tibial tuberosity all the way up to about mid-thigh. You want to make sure you're not really cutting the muscle in half, but you're limiting enough to focus on the knee joint. Okay? That. Then you'll place your anchors with your white tape. So once again, try to have them be slightly flexed so that you don't make it too tight. If you want to point your toe, perfect. Yeah, that way. Get a little bit of flexion in there. And you'll lay your anchor strips. If you are doing like the MCL, you'd put your X's here, and same for LCL. If you're doing something for the back of the knee, X's would go here. We're going to do just an overall knee, so we'll do both sides for the X's. So you can start on the quad and pull down to make your first part of the X here on that part. You need 3 more strips. And then same, you'll pull from about over the tibial side up to the thigh. So there's my nice clean X. And then on the other side of the knee, you'll do essentially the same thing. You see that kind of come through. And that way we're going over those ligaments and kind of reinforcing them so it's a little bit more sturdy. I like to add a safety strip of just a center coverage so that way that you have a little bit more support on the knee. And this will act to go over those ligaments and protect those spots. Even if they have meniscal pain, it will take some of it off. Then you'll take your white tape and you'll cover up your anchors and just sort of close everything up. When you finish a job, a tape job, they call it closing. So you just go in over all your work and make sure it's on there tight so they can play in it. Okay, so for a tennis or golfer's elbow or epicondylitis, either one, which would be a strain of these ligaments on the outside of the elbow from like a hyperextension or an over rotation, you're going to have the patient just kind of have their arm relaxed and slightly bent. You can cover it with pre-wrap just to have a base so that you don't give them any discomfort or chafing with the tape. So you'll go from about mid-forearm to about mid-bicep, I would say. When you place the anchors, you're going to use a white tape, and I always ask the patient to kind of flex their arm a little bit so that you don't make it too tight that they can't move their arm. I like to place 2 anchors just to give myself a bigger base. And then same down here, you'll have them kind of tight in the forearm, so make a fist. And then you'll place your bottom anchor for the other part of the tape. With this, you're going to use an elasticon or a stretch and kick tape. And you can change where you put the X's. It's going to use an X pattern to limit their movement. So if they have pain over here, you can put the X here. If they have pain over here, you can put the X here. If it's general, just overextending of the elbow, you'll put the X over the center. So for this, we'll do it over the center just so you can see it better. You'll rotate their arm, have them slightly flexed, measure out what that would be, and then you're going to cut 3 strips to that measurement. And those are going to be your X strips. Okay, this tape is a little thicker and it limits them more, but it's a little harder to work with at times. So you'll keep them flexed like that. Start 1 strip here and wrap it around to the base. This is where you're going to get your X. And then you'll do 1 up the center just to kind of reinforce that immobility. So the idea is they can't go past that and they can't damage the elbow any further or make it any worse. Then you'll close just by covering up your anchors and re-anchoring those pieces of tape. If the athlete wants to, sometimes you can close by going over with like a stretchy tape so that no opponent's fingers get stuck in here and they can't hurt themselves or anyone else. With that, as you can see, go ahead and try to straighten your arm. Gives a little resistance so they can't really make it any worse. Okay, so for a hamstring strain, the common wrap would be to use an ACE wrap and just provide compression around it. Hamstrings like compression. It's like a little hug for the muscle, and it kind of helps the patient be aware when not to fire. So you're going to start, I always start out in the front here, go around the leg. A good way to use ACE wraps is to overlap a little bit and dog ear down. That way when you come back around to hold it down, the wrap won't move and it won't slide or unravel as often. You want to keep good compression and wrap up towards the heart so blood flow goes back to the body. And I like to go just below the bottom of their glute and keep a good amount of compression as I go. You can close the tape with either the little clip sutures provided, but if they're going to be in athletic play, you normally want to go over it with like a stretchy or a white tape. This doesn't really limit their mobility so much as it just kind of reminds the muscle to stay flexed the whole time when they're working. That would be a hamstring compression.